Just a little bit of background about myself. I graduated UCI, biology major in 2008, was also a member of Pre-Pharmacy Society. I graduated from USC, received my PharmD in 2012, and I'm actually still currently in school right now, which I'm graduating next week and getting my postmaster's certificate in health informatics. And I also have some certifications, professional certifications. One of them is the CP-HIMSS, which is Certified Professional in Health Information Management System. And then the other two are similar, the CSSBB and LSSBB. They're both Six Sigma type of certifications, which talks about process improvement and reducing wasteful steps and things like that. And I also host two different podcasts. One is the OCPHA podcast, which is part of the Orange County Pharmacists Association. And then the other one is my podcast for informatics, which is Pharmacy IT and Me. In terms of my current jobs, when I started my career in 2012, I worked as a clinical informatics pharmacist at the Ventura County Healthcare Agency. I was there for 5 years to implement their new EHR and then multiple different smaller technology modules with it, as well as maintaining their system until I left in 2017 to go to Chalk Children's as a pharmacy IS specialist, which I'm doing mostly the same thing, but I have additional projects that I'm doing right now. And also since 2012, what I also do is I'm a per diem pharmacist in the inpatient space at Kindred Healthcare. And the reason why I do that too is that I feel strongly that you can't really do the informatics role if you don't have the clinical background or if you're not part of a clinical workflow. So it's kind of like, what's the point of like knowing these technologies if you don't know how to apply it to make the process better? And that's why I try to maintain a clinical workflow position. So roles and practice settings. So I'm just going to go back a little bit more general about pharmacists and what are pharmacists trained to do. So pharmacists, they are the medication experts. They serve an important role in patient care and the patient's well-being. I'm sure many of you know this. You guys are in the Pre-Pharm Society. They play key roles in dispensing medications, making sure that they are correct. Medications also have side effects, so pharmacists are key in informing patients about monitoring the side effects. And pharmacists don't usually work by themselves. They also collaborate with others, whether it be in a pharmacy, they collaborate with pharmacy technicians, whether they work in a clinic setting, they're collaborating with doctors, providers, and whether they work in a hospital, they may be collaborating with nurses. There's a lot of collaboration. And in addition, there's also safeguarding, and they also advocate for the patient. They are the most accessible healthcare provider out there. So it's very important to note that they are a huge patient advocate. So there's a lot of different specialized routes that pharmacists can go into. And today we will be speaking about informatics, but I just want to give you, some examples of the different positions that pharmacists can do outside of informatics. There's community pharmacy, which is the retail setting. There's also independent pharmacy, which is, kind of like a retail setting, but these are pharmacists that want to own their own smaller pharmacy to serve their local community. There is also inpatient pharmacies. And these are the pharmacies that are usually in the hospital that supply all the medications for anything that is occurring in the hospital, like whether it be codes, whether it be just regular orders for an ICU patient, things like that. There's also ambulatory care and MTM. And ambulatory care means these are for patients who are ambulating. So they're usually in clinic settings. And these pharmacists are almost like visiting a provider, visiting a doctor. You see these pharmacists and they monitor your medications. They make sure that your dose is correct. They make sure you're not experiencing too many side effects. So you have appointments and you see them like that. There's also positions in managed care. And managed care is talking about population health. And these are like the big PBMs. These are the big insurance companies. Pharmacists can work in the managed care, being on the side where they're receiving these claims, these insurance claims, and they would be reviewing to see if these are appropriately ordered and appropriately managed by the provider. So they would approve or not approve the claims. There's also the pharmaceutical industry, and you've probably heard of this, that these are the big pharmacy companies that are developing these new medications. Along those lines as well, there's also investigational. So investigational is related to all of the clinical trials out there. Like for example, at where I work right now at Chalk Children's, we have an investigational pharmacist who is in charge of multiple trials to ensure that all these patients are appropriately given the right placebo or the right experimental drug, and making sure the side effects are not like very very detrimental to the patient, determining when the study should be stopped, things like that. So that's another avenue as well. There's also oncology pharmacists. If you look into oncology, it's very complicated. There's a lot of different protocols, lots of different cycles, regimens. It really requires its own specialization. There's also pharmacy administration, which is the managerial side. So you could be a director of pharmacy, you could be a supervisor, you could be a clinical operations, things like that. There's also academia, which is going into education and teaching pharmacy. One of the kind of a little bit more rare fields is pharmacy attorneys. And these are pharmacists who hold a PharmD and a JD. So they are professionals in the law that's related to pharmacists. They can work to defend pharmacists. They can work to litigate. They can work to get pharmacies, independent pharmacies licensed. There's a lot of avenues for them as well. There's also mail order pharmacy, and I'm going to rope that in with home infusion. And these are just pharmacies that are closed door and delivered to certain contracted places. Geriatric pharmacists or long-term care pharmacists, they usually go into like the long-term care facilities to do some audits to make sure that the medications being used there are appropriate for geriatric patients. And then I do have highlighted pharmacy informatics, which we will go into extensive detail. But there's also veterinary pharmacy, which is about pets. And there's pharmacy consultants, which are hired for a variety of reasons. So these are a lot of different career paths that pharmacists can follow. So does anybody have any questions yet about these paths? All right, so I don't hear any questions. And move on to the next slide. So roles of pharmacists in technology. Pharmacy informatics sounds like it's just one thing, but there are many different roles. So there can be informatics pharmacists or IT pharmacists. There can be pharmacy liaisons between the pharmacy department and the technology department, the IT department. There can be pharmacy project managers that manage specifically implementing technology for pharmacy. There can also be pharmacy data analysts and pharmacy applications analysts. And there are also pharmacy data scientists. There's also many more roles that are still being created now because this field is still new and booming, especially with like new things like virtual reality, AI, machine learning. There's a lot more things that's going to happen in the future. So in terms of the practice setting, there's different areas that they can practice in. On the managed care side, there's a lot of data in managed care, and that's kind of tied into public health. Data is increasing exponentially. So what can we do with that data? So informatics pharmacists in this setting, they can perform analytics on that data to try to make sense out of it and apply algorithms that would help them with making clinical decisions for the population. There's also the industry side, which is another area where there's a lot of data. There's also outpatient and community where pharmacists in informatics can work on developing the software that these independent pharmacies use to verify their meds and dispense their medications. And of course, academia, because this field is new and booming, there's always going to be the need for teaching and educating more of the pharmacists out there. Also, like implementation and optimization consultants, sometimes optimization is needed because an institution may have implemented something that is problematic. So they need to hire an outside consultant to come in and tell them what is going on. Like they need to assess it and figure out what the drawbacks are. There's also specialized pharmacy workflow products. And this goes into things like specialty pharmacy and investigational pharmacy. So specialty pharmacy, there's like a certain amount of medications that are high cost, high risk, that they fall under what's called specialty pharmacy. And then through that, there's like more specific accreditation standards that need to be met. So then there's different applications that need to document all this data. And then we need to have pharmacists that are able to implement these technologies to grab all that data so that they can report it back to that accrediting body. And then there's hospitals and health systems, which I've highlighted here because that's primarily where I work. Does anybody have any questions? I know it's a lot of information, so if anyone has any questions, just drop it in the chat, and I'll answer as we go. So informaticists and analysts, these are kind of semantics. They're just two different terms. An informatics pharmacist, by definition, is more like they're focused on the data, and they serve more like a liaison to the IT department. And they are also like high-level project management and workflows. Whereas a pharmacy applications analyst is involved with building and configuring and programming whatever it is that's needed. Things like, managing the formulary, managing what medications are allowed to be seen in the system, managing the infusion pumps and the library of the infusion pumps, managing what's called automated dispensing cabinets. And these cabinets are kind of like available at the nurse unit and filled with these medications that are available for the nurse to pull if the patient needs it. There's also all the data that's involved that is reportable. So they need to write the programming language in a way to pull that data that's needed. And one thing I want to note, though, is a pharmacy applications analyst technically doesn't have to be a pharmacist, but they should have pharmacy knowledge. So these are kind of like the roles out there that can exist. But in the real world, what really happens is that it really depends on the organization's needs. If the institution is large enough, then both these roles can exist separately. Like, for example, at Providence Health, one of my colleagues over there, he is an informatics pharmacist and he oversees like 2 hospitals, and he has a team of pharmacy applications analysts under him. So he serves as kind of like the overseer and then will communicate with them what exactly needs to be built. Whereas for where I'm at right now, we don't have that large of a team. So us 4 pharmacists, we also serve as analysts. So we are also building things as well, in addition to being kind of overseeing everything. So it becomes a kind of like an understaffed issue or undersupported. So it really depends on, how much support there is available at the institution. And then you got to really just figure out what you can do with what you're given. So let me see. I do have a question here. So the question says, feels like the roles of informatics pharmacists are broad and involves with other skills outside of healthcare. What courses do you recommend and the undergraduate to try to see if they're interested in the field, to decide if they want to pursue this branch of pharmacy or not? Okay, so in terms of determining whether you want to or not, I really believe that you have to experience it. So if you are able to, try to reach out. Like if you don't have a LinkedIn profile right now, you should create one and try to reach out to any of the informatics pharmacists there. Many of us are very open to responding, and if you can, like, see if there's any informatics pharmacists that will allow you to shadow or just answer some of your questions. It's really difficult to kind of know or feel like if this is the right thing for you without experiencing it. And in terms of the questions about courses, the only course that I would highly recommend is understanding how data is stored. So understanding what's called SQL, structured query language. That's a very common way for a lot of health data to be stored. In terms of like other programming languages, most health systems, the electronic health record there has their own proprietary language. So you do have to learn again what that is. So if you want to learn something now, it will be more of like understanding the logic behind programming, not necessarily knowing that language so that you can use it in a setting. So because of that, I usually recommend Python as a good beginner because it's one of the most straightforward languages to learn so that you can get a basic understanding of how that works. And then the other thing, because you are in an undergraduate environment now, I do want to highly recommend that you get familiar with pharmacy operations, whether it be inpatient, whether it be outpatient. That's a very important aspect that as an informatics pharmacist, that's what distinguishes you from an IT analyst. is that you are a pharmacist and you have that background. So if you can, try to do that by, just getting a position in the hospital or in a pharmacy and experiencing that workflow as well. So any other questions before I move on? All right. So I wanted to kind of break down what I do in my role. So it's broken down into break fixes versus requests versus long-term project optimization. So first, I want to go over break fixes. So break fixes, it's really just something that is broken. You got to fix it. It's like you're expecting it to work a certain way, and it needs to go through some proper troubleshooting to be fixed. And these usually come to me in phone calls, emails, or our ticketing system. And this is like kind of a basic uh, process of fixing where it's like you need to identify the underlying issue, and then there's also this part where you got to strategize if this is an urgent or non-urgent issue. If it's an urgent issue, then got drop everything to deal with it now, because it can cause patient harm if like you don't fix it now. And then there's also other things like, do you want to just put a band-aid on it now, or do you have time to actually find the underlying issue now to prevent everything from repeating in the future? So there's a lot of like I guess critical thinking involved just in the process of fixing. And it can get really, really complicated with more complicated health IT systems. And just for your understanding, a typical system goes through, like a typical medication use process goes through ordering, transcribing, dispensing, and administration. And if you think about the IT systems, ordering can go electronically. Upon ordering, they can get alerts. Alerts can fire about like, is this medication appropriate or not? And then on the transcribing side, which is kind of going away because everything's electronic. If the screen is showing what is not, sorry, if the screen is showing something different than what is entered, then that's an issue. So that's another problem. And then when you get to the dispensing, what if the medication is not in the system? Then what do you do? And then on the administration side, what if the nurse is scanning the barcode and it's not scanning? So if someone tells me, this medication is not working, I got to figure out what that means. There's so many different steps that I would need to troubleshoot to figure out where exactly is the break. So that's what I mean about this can get complicated with more complicated health IT systems. So here are some examples of break fixes. So CPOE, CPOE is computerized provider order entry. Sometimes they can't find the medication. Sometimes the instructions on the medication is incorrect. And maybe they can't find the medication because it was not enabled for them to order because it's not supposed to be, or now it's able to, but now it's allowed to, but it wasn't updated yet. For e-prescribe, that's electronic prescription. Sometimes the NDC of the medication is no longer available. So that's why an error will be thrown like in an alert. The ADC, that's the automated dispensing cabinet, those cabinets are stored at the nursing unit. Sometimes the nurse is unable to open it to retrieve the medication. And that's probably because either maybe this patient really didn't have an order for it, or the medication that was entered into that system was not the correct one. The MAR is the medication administration record. That's when the nurse will chart in their electronic profile that they gave this medication. Sometimes if that medication is not programmed correctly in the system, then it will throw an error and not allow them to chart. So now they're stuck. They gave the medication, but they can't chart that they gave it. So it looks like they didn't give it. Some other examples, IV workflow systems. So there's an IV room in the hospital for preparing the medications. There is a software that controls it, and there may be issues with that as well. The information may not be flowing correctly from the pharmacy system into the IV software. The BCMA, that stands for barcoded medication administration, which is when the nurse scans a medication at bedside to make sure that medication is correct for this patient. And sometimes that is not working correctly because this medication may not have been entered correctly into the system. CDS stands for Clinical Decision Support, which means mostly alerts. Alerts in the system that was supposed to help the provider with improving patient care. Sometimes these alerts do not fire appropriately. They fire on patients that they should not be firing on. Like, for example, if someone is being, if someone has a poor kidney function, then it's appropriate for the alert to fire. But what if this patient is not having poor kidney function and if for some reason the alert fires? We have to figure out why that's happening. So that's another thing that we need to fix. And yeah, I'm going to skip the comment about pharmacy batches because that gets really complicated. Let's see. And then, so the other part of my day is working on maintenance and projects. So pharmacy maintenance, we have so many drug shortages. If any of you work in the pharmacy right now, I'm sure you've experienced it. So pharmacy shortages are always happening. So we got to make sure our system's up to date to keep up with all those shortages. Make sure that what we have in our system stock matches what our actual stock is. So clinical decision support, again, that's alerts. So if there's like a change in formulary, we need to inform everybody that the medication is no longer on our formulary, so we do not carry it. So that's when these alerts are built. So when they try to order it, then these alerts will remind them, hey, this is not on the formulary anymore. There's also things like new medication entries, new order sentences, which is like the instructions for how to take the medications. There's also new order sets. And order sets are a collection of orders that would help with prescribing things faster. So we would have to build those collection of orders for the providers. There's additional things that are more technical, like configuring user access. There's also training new pharmacists on how to use the system. There's also creating the reports for audits and also maintaining big announcements in the system if there's like a big change. And then one of the things that you kind of don't really get emphasized on in school is the billing aspect. So these systems have to bill for the medication so you get paid. So that's something that we also have to be very cognizant about is, did we bill these charges correctly in the system? Are these charges being dropped when they are being dispensed to the patient? So part of maintenance is also optimizing the existing workflow. So we have things like our electronic pharmacy clinical interventions. So just to back up a little bit on that, pharmacists need to document what they intervene on so that they show that they provide value as healthcare providers to the entire healthcare team. So before doing electronic, everything was on paper. So if a pharmacist on shift, they started calling the doctor, right? Then they have to write down on a piece of paper, hey, for this patient, I called the doctor, but I didn't get a call back. So they pass it on to the next pharmacist. And then the next pharmacist on shift, they have to make sure they have that paper. And when the doctor calls back, what if they don't remember what that was about? So there's a lot of these different issues. The paper could get lost. Paper is just not reportable as easily. Like if you want to pull an audit, you got to look for a whole binder. So part of optimization is making all that electronic and making that have these required fields that are codified so it's easily reportable. So when we pull a report on it, we can quantify these specific interventions that pharmacists do, like whether it be too high of a dose or incorrect dose or the incorrect bug drug match for like antibiotics, things like that. And then on the same vein, when someone requests for non-formulary medication, it's having it on paper is still a challenge for reporting and then not knowing like what is being requested often. So having it electronic, we are able to pull a report where we know these non-formulary medications are commonly being requested. So maybe we should look into it and make these formulary. Same thing with like other things like pharmacokinetic documentation and building order sets for common pharmacy orders. It's more of like identifying what collection of orders people normally order and then bringing it all together into one kind of like set so it's easy for them to order. In addition, we also think about the workflow for a pharmacist. What a pharmacist would review for clinical review may be different than what a doctor reviews, like a provider reviews, or what a nurse would review. So we got to create these work lists and dashboards that hone in on all these monitoring parameters that pharmacists are very in tune to look at, and all these like changing weights and changing heights and side effects and labs, like the things that are most important to pharmacists. That's what I need to build for them so that they can do their job appropriately. uh, something specific over at the pediatric setting is a ketogenic report, because patients that are pediatric, we need to make sure that some of these patients are on a ketogenic diet because they have a high seizure risk. And that's a very specific thing for pediatric that I have to be constantly be aware of, like these very specific pediatric issues to be developing reports for them to use. So I also wanted to mention a big project that I'm involved in is the oncology EHR project. And the reason why this is something I want to mention is that the oncology EHR project is something that is very complicated because oncology in itself is full of different workflows from very different like avenues that don't kind of match with the regular inpatient workflow. So I got to work on building order sets to match the complicated regimens that oncology patients need to be on, and then ensuring that these batches of orders are being printed correctly for the pharmacist to fill. And in the oncology setting, there's a pharmacist 1 and a pharmacist 2 verification. So that adds in some complication to the verification workflow that we also need to address. And then because protocols for patients for in under oncology regimens, they change a lot, especially in the children's oncology group. They change a lot over the years. So we got to make sure like we're caught up with like our order sets to make sure they're always up to date with what's currently out there. And that's always a challenge too, because sometimes we'll get like notified a week before we need it to go live, which is kind of hard to do because there could be like 30 or 40 order sets that we need to go back and rebuild. Some other projects that I'm also involved in is a third-party application for monitoring antimicrobial stewardship stuff, which is like antibiotics and the bug drug matches, and then also updating our IV workflow system, um, upgrading our infusion pumps so that it fully communicates with our EHR. And then as we move our pharmacy physically, we also have to make sure all the technical components are there. So that's all I had in terms of like what I do and what kind of like avenues there are for pharmacists out there. So did anybody have any questions or just any comments? So there's a question that came in. There is a minor available at UCI named Health Informatics that includes courses in medical informatics, computer science classes, and public health. Would this help make a person competitive in applying to become an informatics pharmacist? So because the field of pharmacy informatics is still very new, the health informatics is kind of useful right now because there is really no standard right now in what makes a person a good pharmacy informaticist. A lot of it is based on experience. There's also residency programs out right now that you would finish pharmacy school and then you would do a PGY1, your general residency, and then PGY2 for pharmacy informatics. There's also dual degree programs in pharmacy school where it will be a PharmD / Masters in Health Informatics as well. So there are different avenues to get trained, and just having any kind of like health informatics may make you a little bit more competitive. But at the same time, if someone has more experience, then they may get the position before you do. There's still a lot to say about the experience. But having said that, you may get some experience opportunities in a educational program. Like I know for master's programs, they kind of require you sometimes to get some experience. Right. So another question I have is, can you tell us more about what type of topics you discussed on your podcast? So my podcast for pharmacy informatics is focused on three things. One is basic introductions to topics that I kind of find useful for the daily pharmacy informaticist or someone that's brand new to informatics. The second thing is I try to recap the news if I can every week. Sometimes I don't, but I try to every Friday about anything in health IT. And the third thing, which I find is the most value, is I try to interview a lot of different pharmacy informaticists out there to try to get what they describe as their day-to-day job. Because there's so many different avenues and so many different roles out there. It's always like, even for me, it's always like surprising to hear like what people are doing out there. And even then, I'm learning as well as I'm sharing it with people who are listening. Can you talk about other certifications that you got? Are those certifications related to your role as an informatics pharmacist? So yeah, so the CPHIM certification is a general certification for health information management systems, and it is related to informatics. It really helps me have a bigger picture because in pharmacy informatics, I'm working a lot with just pharmacy and not really understanding the outside perspective or the high level perspective of the institution. Um, when I was studying for CPHIMS, it provided me a lot more high level information like project management, what other people are thinking about, risk management, choosing vendors, like choosing the right vendor, a lot of things that are more high level that is really helpful for me to kind of like do my job but be cognizant of what's going on around me. And in terms of the Six Sigma certifications, those are not specifically related to pharmacy informatics. They are more about operational and process improvement. So people who are in med safety, like a pharmacist that is in med safety or a med safety pharmacist or med safety officer, they also could take those certifications to have the Six Sigma certification because they are also all about process improvement. And those are strategies on how to manage a process currently in place and going through data-driven analytics and decisions to improve that process in the end. So that's not specific to informatics, but it is helpful. Let's see. How does the job market for informatics pharmacists look right now? So that's a very difficult question to ask because, I mean, difficult question to answer because there is no clear designation of informatics out there. You can look up the word informatics pharmacist, you can look up pharmacy analyst, you can look up, pharmacy applications. You can even look up tech startups that are in healthcare. Health tech startups may not even list that pharmacist as anything more than a pharmacist, but they are working in technology, and that role is basically technology pharmacist or informatics pharmacist. So there's a lot of opportunities if you look for them or if you make your own opportunities. But if you're talking about specifically informatics pharmacists in a hospital, then those are more limited. And usually those positions go to people who are currently working at the institution and knowing the workflow because they're clinical pharmacists, or people who go through a PGY2 program knowing the system there. Let's see. Another question is, can you share what it's like balancing being an informatics pharmacist and a clinical pharmacist? Yeah, I have to change hats like very distinctly because working on the technology side, you really think big picture, like working with different departments all the time. And then when I switch over to being in the pharmacy workflow, it's a lot more thinking about what am I doing immediately now that will provide improved patient care, like just verifying all these meds correctly, dispensing them, answering these consults really quickly. So there's two different mentalities. On the informatics side, it's more long-term project and deadline and goal driven. And then on the clinical side, it's more like day to day, I need to provide patient care now. So that's a big difference. All right, are there any more questions?
All right. Since it looks like there's no more questions, thank you, Dr. Tony Dow, for presenting to us. If you guys think of any further questions, his contact information is on the screen. But yeah, thank you so much for answering our questions and telling us more about informatics pharmacy.
Yeah, of course. I also wanted to mention one more thing is if anyone is interested in reading about pharmacy informatics, you guys can check out pharmacyinformaticsacademy.com. It's actually something I co-founded with a few colleagues of mine. And there's a lot of like blog content we have right now and some fundamentals. Still developing it right now. So if there's even any suggestions that you guys have, feel free to contact us as well.
All right, that does sound like a pretty good opportunity. Yeah, thank you so much. I do have a couple announcements before we end the meeting. I need to share my screen, so I'll take over. Let's see. Here we go. Okay. Can everyone see the screen share? Okay, thank you. So PPS treasure hunt. Oh, how do I present? So the clue for this week: who dressed up as Pikachu during the Halloween meeting? So of course, if you know the answer, please fill out the Google form in an email. And a couple other reminders: please sign up for the banquet as soon as possible. And if you're interested in doing performance, please contact our social chairs. What is the chat? Okay, and don't forget to write your notes for Illumination Foundation. We also are still accepting donations for the Relay for Life, so please donate there if you want to donate. And yeah, I think that's pretty much it. Thank you everyone for coming to this meeting, and once again, thank you, Dr. Tony Dow, for being here with us.
Thank you. Have a good evening, guys.
Yes, have a good evening, everyone.